Teens, if you have been struggling with functional neurological disorder, short for FND, there are literally 3 things I teach the teens that I work with to get over the fact that they have FND and then get their life back. So if you or people around you are accidentally making your FND condition worse, then in today's video, I'm going to help you to unlock your feeling of being stuck with FND by implementing these 3 strategies. So let's dive in. Hi, my name is Dr. Lee. I'm a pediatric health psychologist and the founder of Teen FND Academy, which is an online coaching program to help teens with FND and their parents like you and your family to literally learn the practical skills and strategies so then you can be done with your FND and then live like a normal teenager again. By the way, if you're finding me, welcome. And if you have been consuming the videos on my YouTube channel, awesome. Hit the subscribe button if you haven't already. Like and share this video because we need to have more people become aware of FND. Therefore, you don't feel like you're doing this all by yourself ever again. So help me help you. Okay, so let's talk about this. Strategy number 1. First of all, stop overreacting to FND like it's a life-threatening emergency. FND is a dysfunction of brain-body communication. So there's nothing wrong with the structural thing. That's why doctors can't find what's wrong with you physically per se, even though your FND is real, right? So FND itself does not really harm your brain or body by just having this FND episode or condition or symptoms, whatever you want to call it. Now, there might be some secondary injury related to that, but it literally, FND itself is not harmful, even though it sucks big time, right? But somehow maybe you or a parent are preoccupied with counting how many episodes you are having, or thinking about having more than 1 or 2 episodes per day is bad, or having more than 1 minute of episode or prolonged episode of paralysis and numbness and things like that, or extreme mood swings because of FND is really, really bad. So what do? Constantly checking the symptoms, either directly or indirectly, or over accommodating either yourself or them over accommodating you, because mostly you and or the parents feel bad for you having this condition and then feeling like a zombie, super exhausted and then tired and frustrated and confused and you don't know what to do. Or you and your parents are constantly on edge like FND is a life-threatening condition. Like if you have this one more time, it's going to damage your brain permanently, kind of thing, which it's not, but it feels like it. So I get it. And again, people around you naturally want to help, right? So avoiding triggers is a pretty common thing. Like, oh yeah, you did this and then you had a flare up. So maybe you shouldn't do that thing again. Maybe it's a Pilates you did that was not helpful and then you had a flare up. So maybe you shouldn't do the Pilates for maybe a month or 2 or 3 months or something like that. But here's the deal. Avoiding triggers just reinforces your brain's this pattern that, oh, when A happens, the symptom happens. So as long as I avoid A, then the symptom does not happen. Well, guess what? The B happens and then symptom comes back. So you're like, oh my gosh, this is so confusing and restricting and limiting. And this is when a lot of teens feel super depressed for a reason. So instead of doing all of those things, you can start focusing on gradual, when I say baby steps, gradual exposure and the nervous system regulation strategies. Again, that's not it. That's not all you have to do. That's the beginning of the recovery journey. Again, the recovery does not happen overnight. I wish there was something that you can do quickly, like when you're having this emergency of non-epileptic seizures, like right there and then, but it is really about retraining your brain and body. So it takes time, it takes practice, it takes training that you kind of have to do consistently. Number 2, blaming anxiety instead of understanding brain wiring. That is something that I always teach the teens and the parents to stop blaming. Yes, stress and emotions play a big role in FND, but FND is not just anxiety, because FND, functional neurological disorder, does not say anything about functional psychological disorder, right? So it's not just anxiety. It's not just stress. It's not just the bullying, the trauma. It's not just that. You know, I'm not saying like that's not it. It is probably part of it, but it's not just this. So treating the FND as a just anxiety many times leads to these wrong interventions. Like all you need to do is therapy. Again, I am a licensed clinical psychologist, so there's nothing wrong with therapy. Or people tell you, oh, you just have to do trauma therapy, EMDR, all this like this and that, and then all this therapy and that therapy, kind of thing. Well, if they are directly targeting and approaching FND, fine, but if you're literally dealing with other things, maybe somehow related to FND, then you're not really targeting the FND at all. So again, blaming anxiety instead of this understanding brain wiring related to FND is not really helpful. So teens stop doing that. And I'm not saying like you shouldn't feel anxious, like I mentioned. It is an important thing. They're focusing more on the brain wiring part. Number 3, I get this a lot too. Just waiting for the symptoms to go away on their own. Now, I don't know about you, but I hear a lot from these teens, parents, or bystanders. They'll just grow out of it. It's a teenager thing. I mean, what's wrong with that? FND is not something that just grow out of it, because here's the deal. There is a thing called spontaneous recovery. And yes, that is real. A study says that people who have spontaneous recovery, guess what? It's going to come back later. And most times it's going to come back with vengeance. So without active intervention or doing something actively about FND, it's kind of like a cavity. It's going to get worse. Maybe one day you don't have much of the pain because of the cavity, but just because you have less pain doesn't mean that it's getting better if you don't do anything, right? Because it just continues to get worse and worse and worse. Kind of same thing. FND often gets worse. That's why the recovery requires a structured approach like the thing I'm teaching all the time, the Brain for Teens methodology, starting with the what and how and then the why, not the other way around. That is exactly how I'm teaching the teens and the parents in my online program, Teen FND Academy, on how to say goodbye to FND once and for all, right? So again, stop doing the over accommodating or overreacting to FND. Stop blaming anxiety instead of understanding brain wiring, and stop waiting for the symptom to just go away on its own, because you know what? Oh yeah, school's out and I'm feeling so much better. Great. I'm so happy for you. And guess what? The fall comes, it's coming back again. I have seen and worked with hundreds of teens at this point, and every single time the month of August is like, ta-da, great month, and then the month of September, and then all the way to May, June, July is like, oh my gosh, like there's a FND coming back. So don't wait unless you are so in love with living with FND, and then you are like, oh my gosh, this is who I am. I don't want to get rid of it. And this is actually convenient, that I have FND, all of that stuff. Again, I'm not saying that's a bad thing. That is your choice, right? I'm not here to judge you. Again, it has nothing to do with my judgment or my thinking. My program is all about you wanting to get better without FND, so you can have a life that you want and then some, right? Because I truly believe every teen who's struggling with FND deserves so much more and better in their life without FND. Right? So if you are doing these things, kind of making mistakes or not knowing what to do, right? This overreacting, blaming, anxiety, and then waiting for symptoms to go away, then don't worry. There is a way to turn things around, okay? Even though you have had these symptoms for a long time. I have seen it one too many times. And if you really want to learn the inside of what goes on with Teen FND Academy, click the link below and learn more about it. And if you want my help to get you out of FND vortex so you can feel like normal again, you might qualify for my program. Again, check out the link below and then schedule a call to talk to me and see if you qualify for the program. Thank you so much for watching this video, and I will see you in the next video.